This is a giant blackhead. It's probably been there for years, and when they get this large and they dilate the skin open, we actually call them a dilated pore of Weiner, but it is very similar to a cyst that appears elsewhere on the body. It just stretches the skin out. It's full of keratin and oil that is compacted, and when exposed to the air, it turns dark because it oxidizes. As it comes out, it's probably going to leave a permanent little scar in the skin. I previously talked about pilonidal hair sinuses in another video that went crazy viral. This is another example, and this is something that can happen to dog groomers, barbers, and hairstylists, especially if they wear open-toed shoes or sandals, because those tiny little hairs can act like a sliver and get underneath the skin. This caused a foreign body reaction just like you had any other sliver, and the individual here is using a corn pad or a wart patch that you can get over the counter to soften the skin up and help to remove that skin on top. You can see the little hair there that finally comes out. These can be incredibly painful for being such a small thing. All right, let's see what's going on here. I appreciate that we've got some real instruments here. This looks like they've got sterile instruments, they've got a sterile blue towel, but no gloves. I don't understand. Why are we not using gloves when you've got nice instruments? What's the deal with that? This looks like a botfly is going to come out of here. They have to tease it out carefully so as not to break it off under the skin. So a botfly, as it develops under your skin, you can actually start to feel it move and squirm around before it's ready to come out. So pretty gnarly stuff. Here it comes. Oh, perfect, perfect. Except for the no gloves again. Not ideal. That's a big one. That's amazing. Yes! Look at the whole, yuck. And look, all those instruments, no gloves. Oh man. They got 3 botflies out of there, crazy. It's that time of year when we are outside more, out in the mountains, and potentially getting exposed to ticks more frequently. If you find a tick on you, it is important to get it off. If it's been on there for longer than 24 hours, especially if you're in an area where tick diseases are common, you could be at risk for things like Rocky Mountain spotted fever or Lyme disease. However, pouring olive oil over a tick is not a recommended way to try to get that out of there. There's specific devices that you can use. Salt isn't going to help. I don't know what we're making here. You want to get something underneath that tick as close to the skin as possible and pull straight out, not twisting. You don't want to detach the head.
Hey, Cindy Brunette. So, no, she does not. Her thing was she had been shaving and she also had been using Nair. So that's where a lot of her skin abnormalities were coming in from, not HS. However, this client that I am performing an underarm wax on does have HS. She has it on her underarm region and on her pelvic area, her feminine parts. And she came to me wanting a bit of a solution, and she said she noticed and someone recommended to her to try waxing because it also helped them. Now, there are not any studies as to whether HS can help waxing. However, in her case, she has noticed a really big difference in her flare-ups and her overall skin, along with the other changes. And for those who don't know, HS is hidradenitis suppurativa. I believe that's how you pronounce it. Cool?
I can already tell that this is going to be great. We've got a Biore pore strip on a mostly willing participant here, but pay attention as it comes off because these are not just normal sebaceous filaments. They look like tiny vellus hairs, and this could be a condition known as trichostasis spinulosa, where vellus hairs grow on the nose, and it's harmless but fascinating. So a lot of people are under the impression that the purpose of this sticker is to track your tan, to see how tan you're getting versus where your baseline was. But this is actually just because they don't want to get skin cancer in that one little area. So keeping that sticker there really protects that skin, but you get skin cancer everywhere else. This one is worth the wait. Look at this extraction. They're doing it well. I think it's kind of hard because they're looking in a mirror and trying to get those tweezers just right. That's a painful place to get a pimple. But once they get a hold of it, just the technique is so good here. They get a hold of it and just slow, gentle pressure until it comes out. You don't need to yank it out. But look what happens when they pull it out. The thing is huge to begin with for that area, and then splinter, but it's more like the whole tree. Look at this thing as it comes out. They're using tweezers, no gloves, not a sterile field, but hopefully they clean things off beforehand. She's got what's called a foreign body reaction going on. The body tries to wall this foreign object out so that it can't cause infection or other things deeper inside the body. They've got a good hold of it here, and let's check this out. Ooh, that's huge.
What?
Boom. Now there's an intense amount of inflammation in that area, and this still could have an infection. When you get a wood splinter like that, especially if it's been in there a while, you could be at risk for some atypical infections, not your usual staph and strep, things that don't necessarily respond to the typical antibiotics. So if this doesn't start resolving pretty quickly, I would definitely go see a doctor. All right, here's a pretty satisfying extraction. This is hard to do. They're doing it in a mirror, so you got to get it just right so you don't damage the skin. But the technique is pretty good here. Using nice tweezers, getting up in there, doing it on themselves. There's no gloves here. Get a hold of it and just take it slow. Don't have to rush it, don't have to rip it out. So just a little bit. Here it comes. Let's see it. Boom. If you like pops, you're gonna like this one. I can't tell, but I think this might be a navel piercing where the skin has grown over the back. Boom. All right, this is a blind react. We know that there's gonna be something come out of there, but it's hard to tell exactly where the opening to this cyst or big pimple is. We're working on it with no gloves, which of course is not my favorite. Slowly increasing the pressure. All right, there it goes, right down there. You're in the line of fire. You got to be careful. Ah, right down there. It doesn't look like it should come from there. Let's check out this thing that causes a permanent hole in this person's skin. This is probably a dilated pore of Weiner, which is a kind of a large pimple or a very small cyst. You can remove the contents, but it leaves a hole from where it stretched the skin open. Overall, these are harmless. You've got to check out this expression video here. It's important to understand that although this looks like a lot, it's normal for your oil glands to produce oil. Sebaceous filaments are normal. There's nothing wrong with you if this happens. I love that this is being done in a professional setting with gloves, so we're not damaging the skin, but this is normal, but it is really, really satisfying. Two things here. Pay special attention to the third finger there. That bird finger pushing really hard into something, pushing it out up between the index and the thumb. So there's nothing on the foot, and you can see as soon as he moves it away, the foot is fine. I don't know what it is with barbers trying to remove moles, but this is a pore vacuum and they're trying to suck the mole right off the skin. I don't get this at all. This is not going to work to remove a mole. You shouldn't attempt this. This is a really bad idea. All right, we're going to play yes or no on this scalp care routine. According to a dermatologist, he's got some scarring on the back of the scalp, so this is going to be difficult to treat. We're putting lemon on there. This is a no for me. Now we're following that up with baking soda. That's also a no. Maybe it'll get better. A little more lemon, so that's a no. Scrubbing that in. Okay, now we've got soda water. This is a no. And looking at the scalp now, it's no better than it was before. Do not. Few things are more satisfying than watching somebody who's really good at sclerotherapy. This is actually an FDA-approved detergent that's safe for injection into superficial spider veins. It provides pain relief and, of course, a great cosmetic benefit. If you suffer from these, see a dermatologist who performs this procedure or a vascular surgeon. Those are the places you're going to find it. I know a lot of people have talked about removing skin tags by tying something around it, but it's important to know this is not a skin tag. This is actually a type of mole, so you don't want to get the diagnosis wrong. And you can tell he is in pain by this. He tenses up right there. So you can also just numb this up, shave it right off, and have it tested so you know for sure it's not cancerous. But when you necrose it like this and it falls off, they're not getting pathology on it. This is not, I mean, they even have the razor blade available. Why are they doing it this way? No, just numb it up, shave it off, send it for pathology. I have seen a lot of pimple popping videos, and this one may take the cake. Look at the size of this and look at the pressure with which it comes out. It's like he's spraying foam insulation here. This is ridiculous. Oh, it's huge. Should be wearing gloves, ideally. This is the type of thing you should be doing with a doctor. This needs surgical removal. Oh my gosh. Seriously, like spraying foam insulation.
Small is mine.
It's yucky.
Truly incredible. The little girl's right. That's yucky.